you been struggling with depression that just doesn't seem to respond to traditional medications? You're not alone. I'm Dr. Sandra Duncan from BrainWell Psychiatry in Bastrop, Texas, and today I'm going to tell you about a breakthrough treatment that's giving hope to thousands of patients with treatment-resistant depression: Spravato Esketamine nasal spray. Let's start with the basics. Esketamine, marketed as Spravato, is a nasal spray that comes from ketamine. But what's the difference between ketamine and esketamine? While both work on the same pathway in the brain, esketamine has been studied and specifically FDA-approved for treatment-resistant depression. Unlike traditional antidepressants that can take weeks to work, Spravato often provides relief within just hours or days. You might be wondering if Spravato could be right for you or someone you care about. Ideal candidates for esketamine treatment typically include people who have tried at least 2 different antidepressants without adequate relief, are experiencing moderate to severe depression symptoms, and are medically stable enough to receive treatment in an office setting. It's important to note that Spravato isn't typically a first-line treatment. We generally consider it when other approaches haven't provided patients with enough relief, which is why it's specifically indicated for treatment-resistant depression. I'm thrilled to share some breaking news about Spravato treatment. The FDA has actually just approved Spravato for use as monotherapy, which represents a significant advancement in depression treatment options. What does that mean for you? Until now, patients needed to take an oral antidepressant with their Spravato. Now, eligible patients can receive Spravato treatment without necessarily being on an antidepressant medication at the same time. This is especially important for patients who can't tolerate traditional antidepressants because of side effects, or who haven't found much depression relief with them. This new approval gives us more flexibility to personalize your treatment based on your specific needs and response. What can you expect during a Spravato treatment at BrainWell Psychiatry? Here in Bastrop, we've created a comfortable and caring environment for your session. The treatment is self-administered under our supervision. You'll use a nasal spray device and then stay in our office for about 2 hours while we monitor you. During this time, you might experience a sense of dissociation or mild changes in perception. This is normal and typically resolves before you leave. Because of these potential effects, you'll need someone to drive you home afterwards. Most clients start with twice-weekly treatment for the first month, then typically move to once a week, eventually reaching maintenance doses, which is treatment once every 1 to 2 weeks. The results we've seen at BrainWell Psychiatry have been remarkable. While not everyone responds the same way, many people experience significant improvement in their depressive symptoms, often as early as the first few sessions. What makes Spravato so different is its ability to help people who haven't responded to traditional treatments. For many patients in the Austin Bastrop area who are dealing with treatment-resistant depression, this has been a life-changing option. And now, with monotherapy approval, we can offer this innovative treatment to multiple patients who need it. If you've been struggling with depression that hasn't responded to other treatments, I encourage you to reach out to us at BrainWell Psychiatry, serving Bastrop and the Greater Austin area. We're here to help determine if Spravato might be the right treatment for you, whether as a standalone treatment or in combination with other approaches. Take that first step towards relief. Schedule a consultation with us either through our website or by calling the number on your screen. Remember, treatment-resistant depression doesn't mean untreatable. I'm Dr. Sandra Duncan with BrainWell Psychiatry in Bastrop, and we are so excited to be able to offer this treatment and help you with your journey to better mental health.